Today we'll be discussing about the role of varicocele surgery in infertile people. Suppose the sperm count and quality is on the lower side and your scrotal Doppler scan shows that there is either grade 2 varicocele on both sides, or at least one side there is a grade 3 varicocele. Generally doctors recommend surgery. The most common question my patients ask me is, doctor, how this varicocele surgery helps in sperm production. So let us discuss in this video. See, now sperm production happens inside the testis. Now whenever there is varicocele means abnormal or defective or damaged veins inside the in the testis or scrotum. So what happens when these abnormal veins are there? Normally the testicular blood supply or impure blood from the testis which is supposed to go to heart, which carries all the abnormalities, all the impurities, toxins and carbon dioxide, and generally this blood has to go to heart, and then where it has to get purified, and then it has to come back to the testis. Fresh blood has to come back to the testis through arteries. So now when these veins are damaged, now what happens is the blood which is supposed to go to heart for purification, it stops in the testis, it keeps rotating inside the testis, and since this blood has all these impurities and too much of carbon dioxide, generally the testis will stop its work. So testis has only two functions, one is testosterone production and second one is sperm production. So now whenever we do varicocele surgery, and we generally close those veins which are damaged, we won't be closing all the veins which are there. Generally people are afraid, doctor, whenever we close all those veins, what will happen to my testis? Is there any side effect, or how the blood flow to the testis will happen if you cut all the veins? In varicocele surgery, it's not complete varicocele surgery. We call it as selective varicocele ligation. That means only those veins which are totally damaged, we will be closing them. Remaining veins, there will be some veins which are healthy, we won't be touching them. So the normal circulation keeps on happening. So we don't have to cut all those veins. Previous days we used to, when the understanding of varicocele was not proper, that is what we used to do. Even in embolization or sometimes when we do open surgery or laparoscopy, we block the main vein. So now we don't have to, we do only selective varicocele ligation, and once you block those veins, you are actually stopping the reversal of blood. So the pathway where the impure blood comes back into the testis, you are actually blocking that. So these impure veins, those blocked veins, slowly they will get atrophic, they will become small, and body will take care of them, and body will try to produce new veins so that the blood circulation comes back to total normalcy. So that varicocele doesn't mean that, surgery doesn't mean that you are blocking entire testicular veins. You are only trying to correct those abnormal veins, and body will produce new veins. Once the new veins forms, the testis will testis will get purified blood, more of purified blood. Along with the purified blood, it will get oxygen and all the nutrients. So this oxygenated blood starts circulating in the testis, and the testicular function will start again, and there will be drastic improvement in the testicular function. So testicular function, as I said, it can be testosterone production or sperm production. So initially sperm count may not improve, initially sperm quality will improve. At a later stage even the sperm count will improve. Generally it takes around 3 to 4 months for the testis to come back to its normal function. That is the reason we don't do semen analysis test immediately after varicocele surgery. You have to wait at least 3 to 4 months for the testicular improvement. So immediately after the surgery, don't try to hurry, don't try to do repeated semen analysis tests. You have to wait for at least 2.5 to 3 months to do your first semen analysis report.